implant with a high projection, and the MEM implant with a low projection. With this patient, we will use the Replicon implant. Because of the anatomical implant profile, an accurate positioning of the implant is mandatory. The 6 o'clock line helps us to achieve this. For volumes of up to 250 milliliters, we recommend the MEM implant, since a Replicon implant of that volume has a higher compression resistance. A slight rotation of the implant will help during insertion. To overcome the friction coefficient, we use a water-soluble lubricant. It is necessary to preserve the integrity of the polyurethane coating. The original packaging includes a celastic sleeve, which helps insert the implant according to the gentle Dolsky method. Another advantage of the Dolsky sleeve is that it avoids contamination of the implant with germs from the skin. After implant insertion, the Dolsky sleeve can be removed easily. Positioning of the 6 o'clock mark at the lower pole. The vertical position is correct. So-called add-on implants were developed to even out irregularities. Here, the usage of an add-on implant in the context of a post-mastectomy primary reconstruction. The intention is to even out the peristernal rim. To prepare the augmentation on the contralateral side, the Replicon implant is covered with a water-soluble lubricant. Correct orientation. Careful positioning in the prepared prepectoral cavity. Careful smoothing of the implant. Demonstration of the delicate capsule which encloses the expander. Extraction of the skin expander and the valve. Mandatory for the integration of the polyurethane-coated implants in the surrounding tissue and vessel system is an almost complete removal of the capsule. After rinsing with saline solution, the Replicon implants are inserted into the implant cavity. In order to improve the breast shape, another implant is placed on top of the first one. The short implant with moderate profile and a volume of 250 cc's is inserted under alternating pressure of the fingers. The final smoothing of the implant to make sure that no folds remain in the surface is highly important. Contrary to textured implants, the pocket can be prepared somewhat larger. Here, the positioning of the 6 o'clock mark to better control the orientation of the implant is visible. With the patient in an upright position, the symmetry is checked. Important are the symmetrical position, laterally as well as at the submammary crease. The wound is closed in layers. A few stitches with 3.0 Prolene fix the implant in its pocket. The dermis is closed with 4.0 or 5.0 Vicro. A suture to relieve the edges of the wound is done with a nylon thread. It serves to relieve the scar and as a final closure. Dermabond, a fibrinogen glue, seals the suture, protecting it against infection and making it waterproof. Sterile swabs and a tape dressing complete the augmentation. The tape dressing is replaced with a sports bra after 1 week. The suture is removed after 2 weeks, and after 3 months, the final consultation follows.